Dr. Dave here to talk to you about colostomies. Now, I realize this is not everyone's favorite topic, and I need to point out that most surgeries that remove part of the colon can be done without the need for a colostomy. But sometimes it is necessary to create a colostomy, and I do have to perform this surgery from time to time. So let's go over it. The term ostomy means an opening, and in this case, it's an opening in the abdominal wall where the colon comes out, which is why it's called a colostomy. Wait, what? So how does that happen? Why does somebody need this? Well, for different reasons. Often for emergent situations like a ruptured or perforated colon, this is done as a life-saving measure. It requires pulling the colon up through the muscle and then attaching it to the skin. This is often done in a situation when it is not safe to reattach the colon, so keep watching and I'll cover all the major points and hopefully answer any questions you may have. I'm a colorectal surgeon in Denver, Colorado. I work with Denver colorectal specialists. Please check us out on the web. I trained at the Mayo Clinic, and I've been doing this for 25 years. So scrub in with me, Dr. Dave, as I help you understand the seldom wanted, but occasionally necessary colostomy. Okay, so first, there are many types of ostomies, which again means an opening to part of the intestinal tract or even a hollow organ. So an opening to the colon is called a colostomy. If it's from the ileum, the last part of the small bowel, it's an ileostomy. From the stomach, it's called a gastrostomy, but I'm going to focus here on colostomies. Now, an ostomy is also frequently referred to as a stoma, and for intestinal stomas, there are two basic types. An end stoma, where only one end is brought out to the skin, like this, or a loop stoma, where the entire piece is brought out, like this. And a small opening is made in the intestines to allow the waste to come out. And though you might think, well, a loop will just allow the waste to continue back down the other opening, believe it or not, this actually rarely occurs. Now wait. You're probably wondering, where does this waste go when it comes out of your body? Great question. An ostomy bag, which is also referred to as an appliance, is attached to the skin, covering the stoma, and collects the waste as it comes out. Unfortunately, a person is unable to control when this is going to happen, so this appliance stays on all the time. And when there is sufficient waste in the bag, a person then just goes into the bathroom and empties it into the toilet. And believe it or not, when someone with a colostomy goes out in public, people around them cannot tell that they have one. You don't believe me? Look at this photograph and see if you can tell which person has an intestinal stoma. Can't tell? It's her. Surprised? Well, see, it's not as obvious as you might think. Now, I won't go into details about the different reasons that some people get an end stoma or a loop stoma, but if there's interest, I'm happy to make a video about that. But some colostomies are permanent and others are temporary. One of the most common reasons for a temporary colostomy is emergent surgery for perforated diverticulitis. And if you want to learn more about diverticulitis, check out my video here on that topic. So when the colon is perforated and needs to be removed, it is often too damaged to reattach. So an end colostomy is made. And once that person has recovered enough, usually about 3 months, the colostomy is closed, meaning the colon is reattached. And if you want to watch my video on how I close a colostomy, check it out right here. And that's my review of colostomies. Thanks again for watching. Tell all your friends that you scrubbed in with Dr. Dave today and learned all about colostomies. Feel free to like this video and I'll keep making more. And if there's any other colorectal topics that you want me to talk about, please put that in the comments below. And I look forward to seeing you at my next video.